ever cannot stop thinking about any flaws that you think people might see in your appearance? Do you repeatedly check the mirror, sometimes for many hours because you feel so anxious about how you look each day? If the answer is yes, then you might be suffering from body dysmorphic disorder. Body dysmorphic disorder, BDD or body dysmorphia, is a mental health condition where a person spends a lot of time worrying about flaws in their appearance and on their body parts. These flaws are actually often unnoticeable to others. You may feel not confident, ashamed, and anxious that you may avoid many social situations. When you have body dysmorphic disorder, you intensely focus on your appearance and body image. Your perceived flaws and repetitive obsessive behavior can cause you significant distress and impact your ability to function in your daily life.
Some symptoms of BDD includes avoiding mirrors, wearing scarf, makeup to hide up personal appearances, constantly exercising and grooming, asking people about appearance all the time, not believing people when they say you look fine, seeking for healthcare professionals to ask more about your appearance, conduct unnecessary plastic surgeries on themselves, and lastly, picking their skin using fingers or tweezers. To be diagnosed with BDD, a person must be abnormally be concerned about a small body flaw or even a non-existent one. His or her thoughts must be severe enough that this disrupts them from living a normal life. Other mental health disorders must be ruled out of the person's symptoms when looking at diagnosing BDD. Some complications of BDD include low self-esteem, social isolation, major depression, social anxiety disorder, eating disorders, suicidal thoughts, skin picking, and lastly, physical pain due to multiple plastic surgeries. And that is all when it comes to side effects, complications, and diagnosis of BDD.
Body dysmorphic disorder, like many other mental health illness, can be caused by a mix of factors. The first one will be about the abuse and bullying. When you are subjected to abuse or bullying, you may acquire a bad self-image and develop obsessions with your appearance. This is especially true if you are a teenager who has been subjected to abuse or bullying and is concerned about the way you appear and how your body is evolving. The second one will be low self-esteem. You may become concentrated on areas of your appearance that you desire to improve if you do have low self-esteem. It's more likely if you place a high value on your appearance or believe your appearance is your most precious asset. Next, it will be the fear of being alone or isolated. You may establish true patterns that lead to BDD if you are concerned about not fitting in with a group of mates or being lonely. If you believe you need to look a specific way in order to keep friends or find a relationship, for example, you may develop detrimental concerns about your look. If a relation breakdowns or a body group change, your worries may become much more serious. The fourth one is about perfectionism or competing with others. You are more prone to developing body dysmorphic disorder if you try to seem physically perfect or comparing your appearance to others on a daily basis. It could be a greater risk if you have a hobby or employment that is heavily focused on your body, such as modeling, bodybuilding, or gymnastics.
Body dysmorphic disorder affects 1.7% to 2.9% of the general population, or roughly 1 in every 50 people. Because people with body dysmorphic disorder are often hesitant to disclose their symptoms to others, it's possible that it's even more common than this. Body dysmorphic disorder affects an even higher proportion of people seen in various healthcare settings, for example, cosmetic surgery, cosmetic dental, or mental health settings. Not only ordinary people like us will suffer from body dysmorphic disorder, the popular celebrities also suffer from this disorder. For instance, Michael Jackson. He freely spoke of the abuse he suffered at the hands of his father when he and his brothers formed a band in 1964. Since then, he has faced the difficulties that often accompany celebrity, such as body image issues. Michael's appearance changed dramatically over the last 20 years of his life. He appeared to have multiple plastic surgeries to change the shape of his nose, chin, facial structure, and skin tone. Given the number of cosmetic procedures he underwent, the frequency he isolated himself from the public eyes, and the cover-up attire he frequently wore, it's possible that Michael suffered from body dysmorphic disorder. According to some reports, he also suffered from health anxiety and an eating disorder.
Prevention is better than cure. Although there's no known way to prevent body dysmorphic disorder, here are some tips on how to make yourself feel less conscious of your appearance. First off, accept your true self. You need to reconcile with your flaws. Try more new things to discover your advantages other than just focusing on your looks. Over time, you will find that you are much better than those around you, and self-confidence will arise spontaneously. Secondly, reject appearance marketing and learn to please yourself. Don't follow unrealistic beauty standards and trends blindly. Build beauty based on health and happiness, not to get compliments from others. Self-affirmation is important. Praise yourself more, such as looking in the mirror every day and smile. Tell yourself, I am better today than yesterday, and I will be better tomorrow. However, if you are facing symptoms of body dysmorphic disorder, fret not, because you can always seek help from professional therapists. You will be referred to CBT, Cognitive Behavioral Therapy. This involves gradually facing situations that will trigger your appearance anxiety, so that you will learn how to deal with your fear and self-consciousness. If medication is needed for your condition, your therapist will prescribe you an antidepressant called SSRIs to help you control your negative thoughts and repetitive behaviors.
Body dysmorphic disorder can have devastating effect on people's life, but it is a treatable condition. Don't suffer in silence and remember to seek for treatments. Outer beauty turns the head, but inner beauty turns the heart.